If you've just tuned in, you're listening to Dr. Margaret Ames and Your Dental Health. The mission of the show is to get the word out about biomimetic, minimally invasive dentistry, which is a major shift in dental care. My name is Dr. Margaret Ames. I've been practicing dentistry for over 25 years, and I am a biomimetic dentist. Bio means life, and mimetic means mimic. So biomimetic dentistry mimics life. It's hard to stay within the speed limit when you're excited about getting to work. And the staff is ready to go, and the patient's already seated in the chair. I'm a little behind schedule today, but we'll get her out on time. We're replacing an old leaky silver filling that is, if we left that in, she would end up breaking the tooth. So I'm going to take it out, take out the decay, and then rebuild it biomimetically. Biomimetic dentistry is minimally invasive and non-amputational. Minimally invasive means not drilling too deeply. Okay, we're off. Gotta take care of Anne. And non-amputational means that I don't take away tooth structure that isn't necessary to remove. My glasses. Good morning.
Good morning.
I said, I have to get in there and see Anne. I have it all envisioned in my mind what we're going to do today.
Okay.
Are you relaxed?
I hope so. A little nervous because it's far in the back, but I know I'm in good hands.
When I was in dental school, I was taught to do a crown, cutting away a lot of tooth structure. I remember watching the dentist drill teeth down to stumps. They were like little teepees. Okay, Bonnie's going to glaze that.
Stay open, please.
I was really horrified to see what patients had to go through, how much healthy tooth structure was removed just to put crowns on their teeth. Oh, wow, you look great.
Face to face.
What pretty lips. I knew that there had to be a better way. Another tooth saved. Now, my next patient, I'm going to explain to him what he needs done because he had a lot going on in his mouth. He thought that he had a great mouth and we found all this decay between his teeth. So I think we can still prevent the root canals. Hello. Long time no see. No sensitivity to hot or cold, right?
Yep.
Everything's comfortable?
Everything's comfortable.
Oh my gosh. Come on in here. Same thing's true over here. This got through the enamel and is starting to spread this way. So that's both sides of the teeth are affected. Being that you don't have sensitivity and we're catching this early enough that I can get in there and take out the decay and restore the tooth, I can protect the nerve and restore it biomimetically. So the point of this is to get it done small, conservatively, save all your tooth structure, not jump into crowns.
Once I'm happy to go to the dentist.
That's music to my ears. That is so great. Matt, today we're going to be treating that upper right tooth. The decay is pretty close to the nerve, so we're going to be able to avoid a root canal with this biomimetic technique. Okay, I'm just going to clean the tooth up. This is a slow, meticulous process. I don't want to drill away any more tooth structure than absolutely has to be drilled away. So that's a little red dye. That sticks to decay, but it doesn't stick to healthy tooth structure. In biomimetic dentistry, decay is removed in layers using red dye and a laser. The red dye is used to identify decay and differentiate it from just tooth structure that has become brown. So you're sure that it's decay and you don't over-remove strong tooth structure. Traditional dentistry, you just keep drilling until you get all the brown stuff away, and it may be healthy stuff that you're removing. People don't think of decay as an infection, but it is infected tooth structure. And it actually weakens your immune system when you let decay go. This is a laser that gives me specific readings about the tooth. The laser light is used to identify the presence of bacteria. There's one part where it's 16. I have to get back in there, take a little more out. Wow, that's fantastic. Now that's okay. That's still a low number. Now this is decay in the adjacent tooth, which we're going to do another day. See the difference? That's pretty deep. The laser is helpful in leaving the tooth structure that has been affected, but not infected. So it differentiates what I have to take out because it's infected. What's left there may be demineralized, but if you leave it there and treat it biomimetically, it can remineralize, making good, sound, healthy tooth structure. Okay, so we're finished with all the decay removal. We're just going to take a break, make sure you're comfortable. There's a number of reasons why traditional fillings are not good. One is that they're too big. Too much of your healthy tooth structure is drilled away to put them in. Everything going okay? Another reason is that they leak. Bacteria get underneath and reinfect the tooth from the inside. And the third reason is that they're not flexible. They don't give. They cause the tooth to crack. Over time, the tooth needs to be extracted. You're asleep. That's a beautiful thing. Traditional fillings are also metal alloys, so we don't want junk metal in our mouth. Particularly, there's a great concern now over the presence of mercury in your mouth. There are 5 different layers in a biomimetic restoration. I'm now layering the increments of the filling material so that each layer will shrink and polymerize, and then I'll add another layer so that it will shrink and polymerize, and we won't have any stresses on the internal parts of the tooth. Biomimetic restorations are so closely bonded to the tooth that the microgap is less than 1 micron. So one bacteria can't even get under a biomimetic restoration. So I'm putting another layer in of a material that is a lot like the dentin, the modulus of elasticity, or that's what scientists call it. How much it bends is very similar to the amount of bend that the dentin exhibits. Most of the tooth, the bulk of the tooth, is dentin, which is flexible, which is why we don't always break our teeth. The biomimetic materials that are used to restore the teeth have a certain level of elasticity, hardness, toughness, fracture resistance, and compression strength. So this is the fiber I'm putting into the other filling. I have to make sure that it's all within where the dentin would live. So the layers are small, 2 millimeters, and they set one at a time. If you have a biomimetic filling and you severely damage your tooth, only the outermost layer will break. The inner layers will stay bonded to your tooth so that they will protect the nerve. So now we're going to the outside layer, which has the characteristics of enamel. It's much more wear resistant, it's stronger, it looks more like enamel. And I'm adapting that to the walls of the cavity, one side at a time. Everything out. Oh wow, that is gorgeous. Don't look at the light. Okay, I'm gonna wipe off those bite marks and you are done. When this is profound is 5 years from now. Yeah, look at that x-ray and say, look, he never needed a root canal. Thanks, Matt, you did great. Dentistry that's done today is based on a 100-year-old method. G.B. Black was a great scientist that developed these principles around the turn of the century. And his principles were great for back then when that's all we had. But biomimetic dentistry has gone really to the 21st century. So that those principles, although they served us well for the time, now that we're living longer, we really have to keep our teeth longer. So the biomimetic way throws the G.B. Black principles out the window. I'm on my way to my local radio station where I have a show once a week to get the word out about biomimetic dentistry. Here we are, linewsradio.com, 103.9. If you've just tuned in, you're listening to Dr. Margaret Ames and Your Dental Health. The mission of the show is to get the word out about biomimetic, minimally invasive dentistry, which is a major shift in dental care. It's not 20th century dentistry, it's truly 21st century dentistry, proven by hard science. Society as a whole needs to embrace this. This is my passion. You don't have to have amputational dentistry. Minimally invasive dentistry is here. Patients really need to push to have this movement take hold. Biomimetic dentistry is the healthiest way for dental treatment to be performed. I want to remind the listeners that they can reach me in my office at 631-261-4525. My name is Dr. Margaret Ames. This is Your Dental Health, and I look forward to being on the air with you next week at the same time. Bye-bye.
And that's a wrap.